So a win like this at OHP really sends a signal that discrimination is wrong no matter where it is, and especially in healthcare, which all of us need to access and need for just our everyday survival. Having discrimination and exclusion like this really sent the wrong message. So this victory really sends a clear signal that transgender people have the right to be treated the same as everybody else.
Transgender people like myself are people who were born one gender but know themselves to be another gender.
Well, exclusions in healthcare insurance is unfair for anybody, but especially I would say for transgender individuals because it cuts us off completely. It leaves you wondering if it's worth being yourself. You know who you are, you know who you'd like to be, you know who you live as. Yet when it comes to trying to get health care, you're always denied, and that's a horrible feeling.
The reason why access to transition-related health care is life-saving for transgender people is that we know that without access to basic primary health care, transgender people face alarming rates of depression, anxiety, and that 40% of transgender people attempt suicide at some point in their life. Research has shown us that access to just basic health care that everybody would expect to get reduces that rate from 40% to about 2 to 3%, which is about the same as the general public.
So the insurance question is just one part of this. Now what we have to do is to make sure that our providers are competent and that they're ready to provide this care. I wish that I could say, well, we have dozens and dozens and dozens of people who are ready for this, but that's not totally the case. We have some really amazing service providers, but we need more. And so that's our next step, is to make sure to educate them, to make sure that they get the information that they need to be the best providers to trans Oregonians possible.
The next steps I see are to just make sure that everyone can access health care. This victory is really important. It's a really important policy, but of course we want to make sure that the equality that we achieved in policy is lived and felt, and that folks can access that through a whole range of options.
There's a lot of myths out there about the cost of transition-related care. The reality is that transition-related care actually saves money. And these are services that are already being provided for folks who are not transgender. So it's really not a matter, for the most part, of adding new services. It's a matter of removing barriers that are specifically discriminatory towards trans people.
Institutions in Oregon, such as Oregon Health Sciences University and Legacy Health, have contributed greatly to making this victory possible. I look back at literally the dozens, maybe even hundreds of people that have been working on this over the decade. It feels like one of the most monumental moments in transgender justice here in the state of Oregon. This win is really going to set the bar high and really resonate as the standard that we should expect of all health insurance companies. Everybody should be able to access health care across the country.